Hi, and welcome to the Urban Health Hotline. I'm DJ Wells of the University of Illinois at Chicago's Urban Health program, and each week here on Urban Health Hotline, you'll have an opportunity to call in and have your questions answered about some of the educational opportunities that are available to you at the University of Illinois at Chicago, about health careers and health professions that you might want to think about pursuing, and also about some important education issues that we face in our communities. Remember, this is a call-in show. It's your show. We will take live calls. If you have questions about anything that we're talking about, please call in. The number's there on your screen, 312-738-1060. The lines are open now, so feel free to call. Today, I'm joined by Dr. Demetra John. Dr. John is the Assistant Dean in UIC's College of Applied Health Sciences, and there she's responsible for overseeing the office that is responsible for the urban health program activities in the college. Welcome, Demetra.
Thank you.
Why don't we start with the obvious question, which is applied health sciences. What exactly does that mean?
I knew I was going to get that question. We're a college that houses a variety of mostly related, not always related, health professions. They are very often not known about a lot of people. People often know about medicine and dentistry and nursing. And we house some of the others that we would like you to learn about this evening.
Okay. Well, what are some of those?
We have, and pardon me if I use my notes, we have 5 different departments and 16 different accredited programs. We have undergraduate programs in kinesiology, nutrition, and health information management. We also have a number of professional and graduate programs that include things like biomedical visualization, which I can tell you. That sounds
real interesting.
I'll tell you a little bit more about that in a minute.
Right.
Occupational therapy, physical therapy, disability studies, and we also have master's and PhD degree programs in just about all of these programs.
Okay. All right. Well, you've said some interest. You've used some big words here, so let's get some definitions, if you will. The first one that jumped out at me was kinesiology. Tell us a little bit about what that is and what kind of careers people might want to pursue if they earned a degree in kinesiology.
Certainly, kinesiology is the study of human movement. In its broadest definition. Here at UIC, we have 2 concentrations in our bachelor's degree in kinesiology. They include exercise and fitness and also movement science. The exercise and fitness track is training in learning how to help people to do exercises. Personal training is probably the first thing that should come to mind. Fitness programming in general. It prepares graduates of that track to work in the fitness industry. They can work in places like health clubs, but they can also work in places like corporate settings that have their own fitness programming. They sometimes work in places like cardiac rehab centers, though very often cardiac rehabilitation requires a master's degree. But I would say the fitness industry and then corporations that support fitness or have fitness programs would be probably the biggest areas. And a lot of graduates start their own personal training businesses and their own small businesses in that regard.
One of our favorite urban health program students, Rogelio Martinez, who's a graduate of that program, and he's shared with us many times about some of the things that he's doing along those lines with his own personal training business and that type of thing.
Yes, and he's been quite successful.
Yeah,
well, I know him well.
We're very proud of Rogelio. And one thing that you mentioned that kind of caught my ear just now is the idea of the corporate side of kinesiology, the corporate side of fitness training. That we're seeing more and more of that these days, aren't we? The fact that corporations are recognizing the importance of that type of thing.
Absolutely, and I think there's a variety of reasons of why corporations are supporting preventative kinds of programming and fitness programs. Part of it is just I think, a growing recognition on everyone's part that we can prevent disease by exercising. And corporations want healthy employees because healthy employees
don't call in sick.
They use less of their health care benefits.
Right.
There's also a growing push in healthcare reform to do more preventative medicine. And so all of those kinds of things would be very, very supportive of physical activity programs. So corporations are more and more setting up their own in-house fitness centers.
Sure.
And they're looking for qualified professionals to run those, to supervise those, and to do personal training within those settings. And so this particular concentration in our kinesiology undergraduate degree is a perfect training for that kind of work. And those jobs are growing, and they are out there.
The idea that you can go to work for a Fortune 500 company and just do exercise is just kind of a cool idea.
And that's another thing. Can you imagine exercising? That's what you do. You're
Right.
teaching other people to exercise. You're exercising with them. It really can be a wonderful lifelong career, and it's a bachelor's degree, and I think it's important to emphasize that as well. So many of our other professional degrees are now after the bachelor's degree, so you're looking at many more years of training. But if you're interested in the human body, you're interested in exercise, fitness, and you're looking for a four-year degree, this could be a perfect degree.
Well, let's talk about some of the other things, because there's so many interesting and exciting fields in the applied health sciences. I want to make sure we touch on all of them, and let's jump straight to the fun one that you mentioned, which was it biomedical visualization. Wow.
Yeah, I know, what a name, what a name. This is the newer terminology for what many of you may have known as medical illustrators.
Okay.
So long before there were computers, there was a whole career of people who were artists who were also interested in the human body and in health. And there have been programs where they learned how to do illustration.
Right.
Originally they drew the anatomy books and they drew diagrams for surgeons and for nurses and for healthcare providers. Well, now that we have computers, it's really gone beyond simple drawing and art, and so much of the work now that's done for medical illustration is done on computers.
Wow.
And so it's computer generated. So people who go into biomedical visualization need to love computers and to love to be very creative. It would almost be similar to a graphic arts kind of degree, and it's a master's degree, and I actually believe many of their master's students may have graphic arts as an undergraduate degree, though it wouldn't be required.
Right.
And they're doing really, really incredible things where they're developing programs on computers to use for teaching. So they might develop programs that people who teach in health programming use to help their students visualize and understand the human body. They actually develop a lot of programming for surgeons. And so, a surgeon who has to go in and do the human eye, obviously they know the human eye if they're an ophthalmologist, but having a computer program that helps them kind of guide the process or to teach the residents can be very, very helpful. They also link it with radiological imaging, and so people are imaging and visualizing at the same time. Wow. And it's an incredible profession. So again, the combination of an interest in art and interest in computers would be what you're looking for. And it is a master's degree, typically 2 years after the bachelor's degree.
Wow, very, very interesting. And the notion that you don't have to be perhaps a biology major, but instead could be a computer or an art major and still pursue a degree that's going to lead to a health profession, I think is very interesting.
Yeah, absolutely. And I do think most of the people who come have a little bit of an art background, or at least an art interest,
Sure.
and a computer interest as well.
Very interesting. Now, you mentioned a couple of other things, and I know that for a while we kept hearing that occupational therapy and physical therapy were like hot industries, that there were lots of jobs out there for people who got into OT and PT. Is that still the case? And tell us a little bit about that program.
Yes. Occupational therapy and physical therapy, we know them as OT and PT, are still very, very, very hot jobs. They're typically both rated in the top 10 of good jobs to explore and to try to get trained for. There are many, many, many openings. There's still a shortage of both professions across the U.S. and certainly in the Chicago area. Both programs are offered at what we call the post-baccalaureate level. And what this means is that you have to have a bachelor's degree in order to enter into these programs. Most of the applications come from people when they're in their senior year of college. They apply in the fall of their senior year to enter either an OT program or a PT program. Our OT program is a master's degree program, and it's 2 years long. The physical therapy degree program is a doctor of physical therapy degree program. It is 3 years long. The professions are similar, but they're different. Physical therapy is physical. And I happen to be a physical therapist. So physical therapist, so I know about this. I still practice as a physical therapist part-time. We do a lot of exercise. So if you're also interested in exercise and you're interested in doing exercise not with healthy people out in the community, but people who have illnesses and diseases and disability, PT is another thing to consider. And we're very physical. We do exercise and movement to help people who are recovering from diseases and recovering from disabling conditions to regain their mobility as best as they can and to return to their functioning, their normal functioning and their normal mobility of moving around the community. OTs work in the same regard, but they work more on occupational functioning, and occupation is not your job. Your job is part of it, but occupation, as they define it, is everything. It's your job to get up in the morning and get dressed and to prepare your breakfast and to go to your job and to work at a desk and to prepare meals, to cook for yourself or to cook for your family. So occupational therapists will work on things like dressing skills, self-care skills. If someone has had something like a stroke, they're going to lose the ability to move around, they're going to lose the ability to dress, lose the ability to comb their hair, brush their teeth, to perhaps cook in a kitchen. So OTs will work on all of those skills, and so we overlap quite a bit. The job market for both professions promises to be very, very strong for a long time, because we work through the lifespan with people from newborn infants all the way to persons who might be dying. But a large majority of who we work with are people who are older adults, and there are growing numbers of older adults. There's an aging of the baby boomers, and so there's an expectation that there will be probably a growing need for OTs and PTs in the future.
There's I attended an event recently where we took some students around to meet some of the students that are currently in your program, in the OT and PT program, and they just had some wonderful things to say about how rewarding a career it is, how you can start working with someone and see them regain a level of mobility, a level of function that you just can't see in any other kind of profession. Someone was asked, why did you choose physical therapy as opposed to medicine? And I thought the response was so profound. The physical therapy student said, if I was a doctor, I'd see somebody that one time and make a diagnosis, but because I'm a physical therapist, I get to work with somebody day after day after day and really see the improvement.
And I think that really describes it in a nutshell. It really is that very, very close interaction with clients. Most of them get better, so it's mostly very, very gratifying, and it's very interpersonal and yet physical, and you do need to have a really high level of knowledge of the human body and how it works, and so it's intellectually satisfying as well as emotionally satisfying.
Very, very nice, very cool.